Good afternoon, everyone. Thank you for joining us. Today we'll hear from Dr. Tam, who is Chief Public Health Officer of Canada, Dr. Nu, who is Deputy Chief Public Health Officer of Canada, Minister Miller, Minister of Indigenous Services Canada. We'll also have the opportunity of having Dr. Wong, who is Chief Medical Officer for Indigenous Services Canada. Dr. Tam.
Good afternoon and bonjour à toutes et à tous.
Good morning or afternoon, everyone.
19 in Canada. There are now 80,555 cases, including 6,062 deaths. And 41,108 cases, or 51%, have now recovered. Labs across Canada have tested over 1,377,000 people for COVID-19 to date, with about 5% of these testing positive. We're currently testing an average about 28,000 people daily, and the numbers change quickly and are updated regularly on canada.ca/coronavirus. So it's time to have the talk. That is the talk about what some refer to as quarantine fatigue. As things are beginning to reopen, we want to get out, but at the same time, many of us are still feeling trepidation. Is the time right? How do I keep myself and my family safe? These are valid concerns. COVID-19 has not gone away and the struggle is not over. So we need to talk about the practices that will allow us to go out smart and stay safe. There are still uncertainties and lots more to learn, but there are things that we know now that will keep us safe, including that we need to proceed with caution. Since we're going to be living with COVID-19 for the foreseeable future, we'll need to pace ourselves and go out smart by remaining vigilant with public health measures to prevent the spread of the virus. And this includes physical distancing, 2 meters from others, keeps us far enough away to prevent coming into contact with potentially infectious droplets produced when people cough, sneeze, laugh, sing, or speak, including those who do not appear to be ill. Avoiding touching common surfaces and objects reduces the likelihood of contaminating our hands with infectious droplets, so avoiding touching our mouth, eyes, and nose stops us from infecting ourselves. Cleaning our hands, often with soap and water for 20 seconds, or with hand sanitizer while you are out and after you get back, destroys the virus, and make sure you don't inadvertently infect yourself or contaminate things you touch. Extra layers, like wearing a non-medical mask or face covering, where COVID-19 may still be active and you can't keep a 2-meter physical distance, provides additional protection to prevent spread of infectious respiratory droplets, even if the wearer is not showing symptoms. By continuing with tried and true public health measures, we can all get out safely and keep COVID-19 down. Thank you. Merci.
Merci, Dr. Tam. Dr. Nu.
Merci.
Thank you. Good afternoon. As usual, I will begin with the latest figures about COVID-19 in Canada. There are now 80,555 cases, including 6,062 deaths, and 41,108 have now recovered. This is equal to 51% of the cases. Labs across Canada have now tested over 1,377,000 people for COVID-19, with about 5% of these testing positive. Currently testing an average of 28,000 people every day. These numbers change quickly and are updated regularly on canada.ca/coronavirus. So it's time to have the talk. That's the talk about what some refer to as quarantine fatigue. As things are beginning to reopen, we want to get out. But at the same time, many of us are feeling trepidation. Is it the right time? How do I keep myself and my family safe? These are valid concerns. COVID-19 has not gone away, and the struggle is not over. So we need to talk about the practices that will allow us to go out smart and stay safe. There are still uncertainties and lots more things to learn. However, there are things we know now that will keep us safe, including that we need to proceed with caution. Since we are going to be living with COVID-19 for the foreseeable future, we'll need to pace ourselves and go out smart by remaining vigilant with public health measures to prevent the spread of the virus, and this includes the following measures. Physical distancing, 2 meters from others. This keeps us far enough away to prevent coming into contact with potentially infectious droplets. These droplets are produced when people cough, sneeze, laugh, sing, or speak. And this includes people who do not appear to be ill. Avoid touching common surfaces and objects. This will reduce the likelihood of contaminating our hands with infectious droplets. By avoiding touching our mouth, nose, and eyes, we will not infect ourselves. Cleaning our hands, often with soap and water for 20 seconds or with hand sanitizer while you're out and after you get back. This will destroy the virus and ensure that you don't inadvertently infect yourself or contaminate the things that you touch. Wearing a non-medical mask or face covering where COVID-19 may still be active and when you cannot keep a 2-meter physical distance will provide additional protection. This will help to prevent the spread of infectious respiratory droplets, even if the wearer is not showing symptoms. By continuing with tried and true public health measures, we will all get out safely and ensure that we can keep COVID-19 down. Thank you very much.
Merci, Dr. Nu.
Thank you, Dr. Nu.
Kwe Watkwanuaradu, Tanse Ulukut. Good afternoon, bonjour. Earlier today, the Prime Minister responded to the calls from urban Indigenous organizations across the country for more support and announced an additional $75 million for organizations supporting First Nations living off reserve and Inuit and Métis living in urban areas. Over the past 8 weeks or so, we've seen leadership at all levels to protect the most vulnerable, our elders and youth, and to take collective action to support those who need it most. Women's groups, homeless shelters, mental health supports, assistance with food delivery has been organized by community-based organizations across Canada. In March, we provided $305 million in immediate support through the Distinctions-Based Community Support Fund. This enabled First Nations, Inuit, and Métis communities to address their specific needs as they prepared to react to the spread of COVID-19. To help respond to the pandemic, the fund included $15 million in support for Indigenous organizations that provide services to First Nations living off reserve or Inuit and Métis living in urban centres. Not only including major cities, but also smaller towns like Timmins, Ontario, or Prince George, BC. This funding helped 94 organizations supporting a variety of measures to help youth, homeless, and by providing food baskets, childcare, mental health supports, and sanitation and protective equipment. We've been able, for example, to support the important work of community-based groups like the Urban Native Youth Association, who is supporting Indigenous youth with self-isolation activity packages, technology, and education assistance, as well as financial support for frontline youth workers. We've also been able to support Iqaluit community Tukisiarkvik Society, who are providing Inuit elders with care packages of nutritious food and personal hygiene products, and the North Slave Métis Alliance, who is offering funding assistance to their members for essentials like groceries, prescription refills, and childcare expenses. Other funded initiatives are providing assistance in navigating and accessing the full range of government and community health, housing, and social supports, hiring emergency response coordinators, increased emotional support and wellness counseling, to name just a few examples. But this wasn't enough. We've also been able to fund organizations who are engaging Indigenous youth during this pandemic or are providing technology support in the form of internet connects for family computers or prepaid phone cards for elders, just to name a few. Today's announcement marks a 5-fold increase in the amount of funding for urban Indigenous organizations. And I want to take a brief moment to acknowledge the members of parliaments from all parties who